good evening to everyone. Let me introduce you Humanitas University. So Humanitas University, as Dr. Moshe Cohen mentioned, is a university, but it's a comprehensive healthcare institution which includes university, hospitals, and research, which is based in Milano. Just 1 second, I cannot scroll down the screen. Okay. Oh, here you can see a picture of Milano. I don't add nothing more to Milano. Here is a little bit of history of Humanitas. I mean, Humanitas started in 1997 and started with the accreditation with the healthcare system. What does it mean? Here we have a comprehensive hospital of 750 beds, which serves for the Italian healthcare system. So even if there is a private ownership, patients can come to our hospital and to our hospitals, because there are 10 spread around Italy, for free. So it's not pretty much different from what happens, for instance, in Clalit in Israel. After the hospitals came the research center, which is now an important research center, very strong in different fields and especially in immunology. And at the end of the story was still something missing, and this thing was the educational part. So in 2014 came Humanitas University. But the relation between Humanitas and the university is much more older. Since year 2000, Humanitas were hosting here the degree course in medicine of Università di Milano. And then when in 2014 we became an independent university, let's say that the professor were running the course for University of Milano became Humanitas University professor. Humanitas has 10 hospitals in Italy. I mean, numbers are important. Just our, let's call, flagship hospital, the one who is based where there is the university, makes about 50,000 hospitalizations per year. More or less, all the specialties are present here in our hospitals, which is able to attract from all around Italy. So here you see our 3 milestones, which is clinical activities for sure, which is research, but also education with Humanitas University. Physically, it's pretty much an American model. What does it mean? We are in a big and comprehensive campus, which is about 40 hectares, so pretty huge, where there is hospitals, where there is research, and where there is education. So for instance, our students every morning or every afternoons, they wear their white coat and they walk from the university to the hospital. Everything is done within, let's say, the boundaries of this huge campus. Here there is a video. Okay. This is the number of our students. We have about, at this stage, 2,700 students. About 700 are postgrad students. Postgrad means all resident students who are in the hospitals. We have about 25 different residency programs, or they are PhD students. Just to give you the idea, this is the number that we want to keep. We don't want to grow more. Since intend ourselves to be kind of specialized university in the medical field, and to have the right number of students in order to have the right time and quality and time of tutors and professors to devote to our students, which we think is crucial in the medical education. Briefly talking about two of our programs. One is the medicine. In Italy, we say medicine and surgery, but it's a medical program. And the other one is the so-called medtech program, and I will add more on this. You see, I'm just mentioning, since before going to PhD, you have first to choose the university. We have PhD programs, different programs, postgraduate medical schools. But going to the university, what I would like to stress is that first of all, we are an pretty much international university. When I mean pretty much, we have a good group of visiting professors coming for teaching from all around the world. The faculty is increasing about more or less. At this stage, we have 190 faculty members, and the growing of those coming from outside Italy is increasing a lot during the recent years. And going to the students, consider that about 40% of students in the medical program are not Italian. So you will see a very international environment. This, what you see now, is an important facility of Humanitas University. More or less, our program is stretched like this. Of course, in the first 2 years, you have what we call the pre-medical, the basic science, the pre-medical science, chemistry, biology, biochemistry, and so forth and so on. From the third year, you start the so-called professionalizing activities, which are made of attending the hospitals, which is always the most important thing, but also using the simulation center. So there is an important simulation facility here at Humanitas University, which is used for training students at the beginning, and also for training doctors. In the bottom of the page, you see the so-called anatomy lab, where we use actually cadavers for training activities. These are the pictures of the simulation center. Other simulation techniques. Another important thing, what we aim to do with our students when they come here is also to experience the research world. What I exactly mean. Let's say the curriculum, the study curriculum of clinical studies in Humanitas, but also in Italy, is mainly shaped to create clinicians. But in our view, also research is an important part in the education of the future doctors. This is why we have designed what we call the Virgilio program. The Virgilio program is an extensive, you attend more, is an extensive attendance, I would say, of labs, on top of the clinical activities in the hospital, on top of the professionalizing activities in the simulation center. You will have the chance to attend some of our labs. You will have a tutor who is a principal investigators, in order to let the students to experience also a possible career in research. For us, it's a very important aspect of research. We have just launched a PhD program in translational research, which is dedicated to doctors who wants to learn also research techniques in the labs, and medical leaders more and more are able to stay in the wards of the hospitals, but also, I mean, to run a research lab. I mean, the two worlds of basic research and clinical fields are becoming closer and closer. This is one of the future trends in medicine. Honor tracks. This is another important opportunity to practice. After a while, when you have more or less decided what could be your future, general surgery, orthopedics, internal medicine, whatever, you can join the honor track program. You will have more and dedicated, let's say, experience in the hospital. You will have a tutor who comes from the specific field. It could be a surgeon, it could be an internal medical doctor, depending on what you choose. But we see that the students pretty much appreciate this program because it's something which they can explore, let's say, more in detail what can be their future, what future they can have in the medical in the medical field. So it's kind of orientation program also for our students. MedTech, just let me spend a few words on what MedTech is. MedTech school, it's a program where we embedded in a full medical program and bioengineering program. So in 6 years, you end up to have a full degree in medicine, which is completely, I mean, and like the other medical degree in Italy, but also a bioengineering degree. This program is done in cooperation with Politecnico di Milano, who is an important engineering school in Italy. The first three semesters, you will spend, the first 3 years, you will spend 1 semester in Humanitas and 1 semester in Politecnico di Milano. What is the aim? What is the idea behind this program? It is to create a medical doctor who is more prone toward the technology, which is applied to in the medical field. I mean, this program is for those students who are, I mean, who have not a clear mind if becoming, for instance, an engineer, because perhaps they like technology, they like medicine, they like technology, they like computational subjects, they like math, but also they like medicine. So this could be a combination of both. Humanitas University, of course, we joined the international ranking. You can see here where we are according to the Times Higher Education ranking and according to the Leiden education ranking. How to enter Humanitas University? We have an admission test. For the normal medical program, we have an admission test for the MedTech program. The admission test is what makes, at the end of the story, the entry in the university, the access in the university. So we don't look to the high school grades, all such things. For the medicine surgery, still for 1 year, then it will going to change. But for the intake 2025, 2026, we are going to use a test which is based on logic. Logic means we have 30 questions on what we call scientific thinking, which is kind of math-derived logic. And we have 30 questions on what we call academic literacy. At the end of the story is reading comprehension. I'm happy to tell you that we are going to provide a specific course for Israeli students, which is going to be a complementary course to what Medical Doctor Academy is teaching to you, which will take place in January. So it's completely free. You can join our course and learning some tips and techniques which can help you to have an admission to Humanitas University in case you decide to sit a test. For medtech school, the medtech test is more science-based, but it's a science-based test. It's more like a typical test for the medical programs, which I would say, which is the difference. The difference is that you have more math in this test. This test tend to test more mathematical skills. Since, we believe that you need to be more strong in math and in physics, but above all in maths, in order to succeed in this kind of program where you will study math and physics at an engineering level. Well, these are our services. Of course, here we are if you will come and visit us, we are in a beautiful campus. We have all the services in terms of course, library, dining hall, language lab. We have a student house inside the campus. And important to say, we do USMLE preparation course. We see that a good number of Israeli students think of their future in the United States, and we try to help those students by starting to teach USMLE technique and to do USMLE preparation here at Humanitas University. Going to fee and scholarship. So, fee is 23,000 euros. But we have scholarship both for the medical program, both for the medtech. Scholarship are, in our view, quite generous in the sense that they offset vast majority of the tuition fee. So we provide scholarship of 16,000 euros, which at the end of the story, you can do the math, you can only have to pay 7,000 euros per year. This is what for medtech and for medical students. Of course, you can keep the scholarship across the 6 years. There are some requirements. The most important is you have to manage to pass the exams. To be a good student, with an average grade of 27 out of 30. Let me tell you that regarding the average grade, we are flexible. What we really want is that the students who have the scholarship are able to proceed during their studies according to the study program. Majority of the students, vast majority of the students that receive a scholarship are also able to keep it until the conclusion of their studies. So, well, for the EU students, it's perhaps among your students could be also students who have a European citizenship. It's a little bit different because since they follow kind of an Italian regulation, they are completely assimilated to Italian citizen. And so the tuition fees is ranging from 10 euros, here there is a mistake, to 23,000 euros, depending on the family income. But this is only worth for those who have a European citizenship. Also for those students, there are scholarship for the medical program, and there are scholarship for the medtech program. Of course, scholarship are more. There are 9 for the medical program and medtech, and 6 for the medtech programs, but also applicants in the EU quota are more. So if you apply in the EU quota, there is more competition. I have also to say. So I'm done. I don't want to take lots of time. I think it's wiser to give students time for making any kind of questions or curiosity. They can ask whatever they want.
Thank you. Can you speak a bit about the possibility to do clinical rotations outside Italy if it exists?
Yes, it exists. But I mean, we want our students make an international experience. We also finance those international experience. We have what we call travel grants funds, travel grants programs. Every year we finance about 60 experience of our students abroad. This is done by the third year, but this is not the compulsory rotation. The compulsory rotation has to be done at Humanitas, at least at this stage. On top of this, we can do and you have time to do other experience, especially in summertime. We have a comprehensive networks going from United States to South Korea, many places in Europe. You can make, these are hospitals or research labs, and we push our students to do this kind of experience, but it's not the compulsory rotation, which has to be done in Humanitas.
Thank you. Is the 1 week preparation during January enough? Or do you have any other tips for the students on how to prepare themselves besides our course and your course?
Well, the for sure preparation week is very good. I always advise those who are interested in Humanitas to attend it, but it's never too late to start a test preparation. I can send to Dr. Moshe Cohen some tips, some books that I suggest, and you can start, if you wish to buy these books and start your preparation.
Sure, please do.
Yeah.
Can you repeat how much the medical education cost?
Is 23,000 euros, unless you hold an European citizenship. In that case, is varying from 10,000 euros to 23,000 euros, depending on your family income.
So the students have to provide information about family income and then the tuition fee is determined?
Well, there is a regulation. So there are some for, let's say, income categories, and the students, they provide their family income, and depending on the income, they will drop in one of these four categories. The lowest one is 10,000 euros. The highest is 23. In the middle, we have another two, which are 13 and 17. But this is what is only applied to EU citizens.
Okay. Can you please explain more about the MedTech exam and a bit more about the program?
Yes. Going to the exam of the admission exam is made of physics, chemistry, biology, and math, and a little bit of critical thinking. So is somewhat a more traditional test for the medical programs. I'm sure pretty similar to the ones you are also sitting for the others university, with one main difference. This main difference is that there is more math, since when you will start the medtech, you will have to study math at engineering level, so you need to have more advanced knowledge than what is required to a normal, let's call medical students. Going to the program, you have kind of it's a bioengineering program which is embedded in the medical program. So you will study Of course, you will study anatomy, physiology, pathology, and all the specific clinical subject. But you will also study math, physics, informatics, mechanics, electronics, and all the subjects that are required for to become a bioengineer. It's pretty much similar. You have a program which is similar at Technion in Israel. In your case, it's 9 years. It's a little bit different, but just to give you the taste, it's what you have in Technion at the end of the story. It's for a medical doctor that perhaps foresee herself or himself, yes, in the hospitals, but also in the medtech research fields, also working for the medtech company, also be a startupper in the medtech field. I know you are quite familiar as a country with technology startup in the medtech technology field. Could be for such kind of students.
Where do the students come from in Humanitas?
Well, international students come, let's say, main groups are North America, which includes United States and Canada, India, many places in Europe, UK was leading Europe, Israel, of course, and then more or less from all over the world. But these are what I mentioned are the main groups.
Do I need to learn Italian in order to study in Humanitas?
It's a very good question. Not to start in Humanitas, but since you will you will touch Humanitas, let's say, land, we will start to teach you Italian from the very beginning with intensive course, because to have a very productive experience in the hospital, you must have a good command of Italian, a decent command of Italian. But let me say that perhaps we had across this year many Israeli students. For the time being, I'm only aware of one case who is not able to speak properly Italian. 99% of Israeli students, they learn very well and very quickly Italian.
What is the dropout rate during medical studies?
It's low. It's low. It's it's about 3-4%. 3-4%. For them at tech, it's a little bit higher. And just one thing, of course, medtech could be an opportunity if you like math, if you like physics, if you like quantitative subject. Otherwise, it's better to start a normal medical programs.
Thank you. How do you see the advantage of Humanitas over other private and public schools in Italy?
Well, first of all, the most important thing was the number of students in combination with the big hospitals. Because in our view, you can get a very good quality in the medical education if you have a limited number of students and many doctors and professors who can devote their time to those students. So for instance, any students when in the hospital has a tutor, and the tutor can have only 2 students at most. If you join the Virgilio program, you will have a tutor in the lab and tutor assistants, and each tutor and tutor assistants has at most 4 students. Because in our view, medicine, yes, of course, you will have to read anatomy, to study anatomy, physiology, but then you learn on the field. And if you learn from a person, from from a master who is teaching you and this is transferring her knowledge or his knowledge to you. And you need to have kind of small proportion between student and tutors. And this is what we want to keep. That's why I start to say this is our number of students and we are not to grow more. Because even if you have big hospital, we realize that we cannot take more students. We are at the top of our capacity if we want to keep quality. And that's why we will keep this number of students across the future years.
Thank you. And how do you see the advantages over public schools?
Public schools are varying a lot in Italy, are varying tremendously in terms of quality. And in many cases, they cannot, for budgeting reason, because, listen, when I started to do this work was in 2014, Italian system, every year, Italy as a country had 9,000 places for medicine. Nowadays, medicine has 20,000 available places. So they double the places. And for budgeting reasons, it's somewhat difficult to keep a good proportion between, let's say, teachers, tutors, professors, and students in the public field. But by saying this, could be also an opportunity. I mean, there could be also quality in the world, in the public world. But sometimes the quality is varying a lot.
Clear. How is the world ranking of Humanitas University?
I showed you before. We decided to join the Times the Times Higher Education ranking, where in the medical field, in the specific medical ranking, we are between 150 and 175 in the world ranking. Another ranking that we used to take into consideration is the Leiden ranking, which is only based in research. And as I mentioned, we are very strong. We are 23 worldwide. Just to tell you that Humanitas, yes, is clinics, of course, but there is also lots of research going on here.
Clear. Students, do you have more questions to Michelangelo? Michelangelo, how difficult is it to pass the entrance exam and to get accepted?
Well, if you prepare it, it's not difficult. I mean, it's you know, sometimes I give statistics, and these statistics are scaring. You know, because for instance, if you ask me, okay, give me numbers, you might ask. Okay, if I have to give numbers for the EU quota, and we are talking about the medical program, I have to say that we have 150 places out of 1,400 candidates. But believe me, these numbers are misleading. Not all candidates are prepared. We have many candidates that sit tests just for doing it for sports. So if you prepare it, you have a very high likelihood to pass the test. And if you are running in the non-EU quota, it's even easier. It's even easier. So if you want to join Humanitas University and you prepare the test, I'm sure you have very high likelihood to join the university.
Thank you. If I'm a European citizen, must I apply as a European quota or can I apply as an Israeli?
As a European quota. Of course, if you declare your citizenship.
Okay. Michelangelo, thank you very much for joining us.
Thank you,
Such a late
Moshe.
hour.